A new survey of over 4,000 men in New York City suggests that some men who report being straight also have sex with men. Obviously, some enormous health implications for this kind of survey. Our guest is Dr. Stephen Goldstone, who is an assistant clinical professor of surgery at Mount Sinai, a medical director of gayhealth.com. He joins us from New York. Welcome, Dr. Goldstone.
Thank you for having me.
Tell me a little more about the survey and how it was done and what they learned and whether you, as an expert in this area, were surprised.
The survey was conducted in New York City by the Department of Health. They did random phone calling around New York City, and they talked to over 9,000 people, and about half, a little less than half, were men. And they asked them a series of questions to try to clarify how the men describe their sexuality. For instance, did they describe themselves as heterosexual, gay, bisexual, etc.? And then, of the ones who described themselves as heterosexual, they also asked them questions about who they had sex with. And about 10% of the men who said that they were heterosexual also had sex with men over the past year. And about 10% of married men also said that they had sex with men over the past year. And I was not surprised by that. I think this is the whole reason in medicine why we're trying to move away from the idea of are you gay or straight, but who do you have sex with? That's the most important question that a doctor can ask a patient.
And what makes us think that people would be honest in an anonymous phone conversation like this?
Well, I think they may not be, but if anything, it's going to underestimate the true prevalence. If a person does admit to having sex with a same-sex individual, I would assume that they're being honest. So, if anything, it might be underestimating the frequency.
Now, let me get the numbers straight again. 10% say they had sex also with men, and you said another 10% were also married, meaning...
No. I'm sorry. It was about 10% total.
Okay.
Of men who identified as gay, as straight rather, had sex with men.
Okay. Now, what were some of the characteristics of this 10%? Were they unique in terms of ethnic lines or being married or not married?
They tended to be more often of lower socioeconomic groups and tend more often to represent minorities and immigrants to this country from Europe, Latin America, and Africa.
And I'm assuming that if they identify themselves as heterosexual, they probably don't communicate with their wives if they're married or with their healthcare people if they go for healthcare. In other words, is it a fair assumption to think that many of these at least would keep that quiet otherwise?
I think that's a very excellent point, and I agree with you 100%. It's very difficult for a patient to admit to a doctor that they're having a same-sex relationship, and probably even harder to admit it to a spouse. The fact of the matter is the doctor has to ask the question in a way that the patient knows it's safe to answer it without any judgment or ridicule, etc. And the patient may not answer the question correctly at the beginning, but at least the physician opens the door so that maybe down the road the patient can answer it. And it is a big problem for married women because they may not be using condoms for birth control, so they may be putting themselves at risk for sexually transmitted infections and or HIV that their spouse can pick up.
Right. As a final question, what is your sense of how often doctors do ask patients about this kind of possibility?
Very rarely. And I think that's a very important point of this article. We make assumptions. We see a man with a wedding ring on. We assume that he's straight. We assume that his partner is a woman, that he's not having sex with other men. And I think doctors must be aware of the very important findings in this study, and we must gear our teaching away from abstinence only to encompass all men and all women.
Very good point. Important point and message for all of us. We thank you for joining us this morning.
Thank you so much for having me.